Okay, welcome to this video on acupressure for insomnia. It's so hard when we can't sleep. We're tossing, we're turning, we're looking at the clock, feeling restless. Mind is probably churning over events of the day. And we're worried about when that sun comes up tomorrow and we have to face the day. Getting all these tasks done with half our energy, poor concentration, probably dragging ourselves along, relying on caffeinated drinks. And if that's not enough, then we're, maybe making mistakes because we haven't slept and our mind can't concentrate very well, and we're more irritable and stressed because of what sleep deprivation does to our body chemically. So let me start by saying a few important things about sleep. The most important hours for sleep are 10 p.m. to 3 p.m. That's one of the reasons why shift work is quite difficult on the body, because these hours are the golden hours that create the most restoration and rejuvenation of our body. Going deeper into why that is, we can look at the Oriental medicine clock, where each organ has a period of time where it functions at its strongest. If we align ourselves with this clock, we can really bring a lot of benefit to our health. So what's going on in this period of time, 10 p.m. to 3 a.m.? Well, we can understand that between 11 p.m. and 1 a.m., this is what's called the gallbladder hour. And then from 1 a.m. to 3 a.m., this is what's called the liver hour. Now, these two organ systems are paired together, the gallbladder supporting the liver system, which has a very key role in detoxifying the body and helping the body to perform the repair work that needs to happen every night during sleep. Now, one very interesting aspect of insomnia, there's a pattern that I see quite often in the clinic, is when a person is waking up between this 11 p.m. to 3 a.m. time frame. So this, when I see this, I automatically know that there is a liver gallbladder pattern going on. So if this is you, if this is your pattern, let me introduce you to an easy acupressure point for this. It's called liver 3. It's easy because, well, we've got to talk about what's in reach, right? There are acupressure, acupuncture points all over the body. There's a lot of important ones on the back. But that doesn't lend itself well to self-care in the home unless you've got someone else who can massage you, which is nice. But in any case, just for our purpose today, we're going to work with very important points that are between the knee and the toes, and then on the arms between the elbow and the fingers. So a lot of important points that are between these areas. So we can access all 12 organ channels through these areas. So let's locate liver 3. So we're going to the foot, and we're going between the first and the second metatarsal bones. So if you start with your big toe, and then you move across to the second toe, there's a big depression in this space. So to be precise, liver 3 is found at the halfway mark between the webbing of the toe, that's actually where liver 2 is, and the base of the metatarsals, where the metatarsals meet the tarsals, right here. And so the main thing with acupressure or acupuncture is that you stay on channel. Now, you're going to palpate around, just going to press around and find where the most tender spot is along this line. You may find you have several tender spots. That's entirely normal too. So you're going to work with whatever's tender. You're going to apply pressure, and over time, this tenderness, whatever pain that you have there, is going to subside as the treatment takes effect. This may not happen in the first few minutes, but over time, over several treatments, if you keep working this area for several days, you'll start to see that in a few days it should become less tender. And then don't give up just because it's not sore anymore. You need to keep going and start taking note of the insomnia pattern, maybe within a week of daily acupressure. And note any symptoms that start to lessen over time. So looking at it more, say, in a granular way, maybe we're awake at night for only 30 minutes as opposed to 45 minutes. So that's a win. Or you may notice that when you wake up, you're maybe not fully awake, maybe just kind of drifting between wake and sleep. And that's a big win also. Another thing that happens with this liver pattern is people can feel hot at night. This is what we call liver fire. So the heat in the body coming from the liver system can wake people up during this time. Maybe getting a full night sweat, that happens too. And that can happen with menopausal women, but other patterns as well can lead to this. So you might notice from treating this point that you're not as sweaty, or maybe you don't have to change your pajamas at night. That could be a way of noticing that there's been a change that's happened. So in either of these cases, liver 3 is a great point. So liver heat may be going together with what's called yin deficiency. So yin is a cooling energy in the body. Yin represents that which is calming, cooling, moistening. Okay, so just taking note of any small changes, even if the insomnia hasn't completely gone away, if we notice change in the intensity of our insomnia, we're not awake for as long, or we're not awake as fully, or we're less hot or less sweaty, these are all signs that the acupressure is working. Now, another way we can measure the effect of treatment is to judge how we're feeling the next morning. Sometimes it's hard to measure how long we've been awake each night because we're not watching the clock. We're trying to fall asleep. So another way to take note of this is how energetic are we the next morning? All things being equal, if our diet, exercise, and stress levels are about the same, do we wake up feeling refreshed? Do we feel ready for what we need to do in our day? Now, if we're waking up hungry at this hour, this can mean a few things. One of the main ones is a blood sugar issue. So this is having to do with our spleen system, and the spleen system and the liver system, they work together in harmony. So when harmony is lost there and our blood sugar's out of balance, one thing can be that we're just simply not eating enough, or eating enough of the right foods, namely the blood-building foods, such as the proteins, the dark green and red vegetables, such as beets, kale, broccoli, chard, this sort of thing. In this case, simply getting up and eating those foods should help the person fall back to sleep. And then over time, it's really about fixing our diet more than about acupressure alone. Now, another common insomnia pattern is called heart fire. This pattern shows up in a person who is having trouble falling asleep. They're kind of restless, lots of thinking. The mind is very active, a lot of stress going on in their life normally. So ideally, it should take about 20 minutes or so to fall asleep, maybe less. So if this is you, someone lying there for an hour or more, maybe tossing and turning, or experiencing other symptoms of heart fire, such as anxiety, heart palpitations, which is the feeling of our heart beating in our chest, where we're not meant to feel that. It's just meant to sort of carry on without our awareness. We also might have moodiness, nightmares, bitter taste in the mouth, thirst, small ulcers on the mouth or tongue, and a red complexion. So a great point for this type of insomnia is called heart 8. Actually, we're not going to stop at heart 8. We're going to look at 2 points, heart 8 and pericardium 8. Pericardium is the heart covering. It's a membrane that goes around the heart. So both of these channels, the heart channel and the pericardium channel, can show up with a heart fire pattern. And we can find this just from noticing the tenderness when we press on these points. When we find pain on these points, always think to yourself, I've hit the jackpot, okay? So treating this tender area is going to cause a reduction of these heart fire symptoms. So let's locate heart 8. It's found between the 4th and 5th metacarpals near this horizontal line on the palm of our hand. And then we can also check pericardium 8. So this is between the 2nd and 3rd metacarpals, also up here where this horizontal line is found. And now it may be happening that you've got heart 8 is tender on one side, and on the other side you've got pericardium 8 is tender. That's entirely normal. So we're always going to check left and right. So often things don't show up symmetrically, so don't worry too much if both sides are, different. So over time, using acupressure on these points, we should start to notice that our heart fire starts clearing. Now, even though we might still be waking up, we may start to notice a lessening of the symptoms that I just mentioned earlier. Other things that we can do to help clear the heart fire include avoiding fiery foods. So these are foods like caffeine, spices, warming foods like meat, like especially lamb or shrimp. We can also try to reduce our stress or learn to manage our stress better through meditation and spiritual activities. Another way to help this condition is to be proactive by scheduling time for relaxation. Because this pattern often shows up in people who are juggling too many activities at once. This kind of busyness is what we call too much yang energy. Sleep is yin, it's the opposite. So we need to help the body and the mind move into a more yin state. We can help this along by including more yin foods closer to dinner time or after dinner, such as almonds, walnuts, pumpkin seeds, bananas, mangoes, cherries, lemon balm, what's another one? Goji berries. Okay, and avoiding eating too much of the young foods close to bedtime, meat, spices, alcohol. These are all big no-nos. So, these diet suggestions, these are good for anyone. We should all be having more yin foods closer to the end of the day to reinforce the yin of the body and to promote calm and relaxation after dinner. So a great acupressure point for any type of insomnia is a point on the head called Mian. This point is found behind the ear. So you're going to go 2 fingers behind the bottom of the ear, so basically your earlobe. And it's under this bony structure called the mastoid process. So you can press your thumb into here and just massage this area for a few minutes. You might feel that it's actually tender. This point treats insomnia, heart palpitations, restlessness. It's very calming. It functions to calm the shen. The shen is another word for mind. It reflects the subtle aspect of the heart. So the heart and the mind are considered together, heart and mind. Okay, so the heart being, physical organ, and the shen being the mental aspect that returns to the heart organ at night. And so when the shen has trouble returning to the heart at night, then you get insomnia. So we always want to keep a calm mind, a calm shen. And this point also calms the liver. So this will work for any of the patterns that I've listed so far in this video. Okay, so this point and Mian will work for all of the patterns that I've listed so far in this video. So this is just a brief instruction on how to treat insomnia with acupressure. 3 points you can use to fit your pattern. I hope this is helpful to you and that you sleep well. Take care.